Evening, how is everyone? We are on a Thursday night, that means we are one step closer to the weekend. Just want a bottle of water. I don't know what date it is, I think it's the 15th of October, so we are on Thursday, 15th of October 2020. We have had World Mental Health Week this week. June, how are you? Pleased to see you, thank you for joining us. We've had World Mental Health Week, we had World Mental Health Day, we are getting closer to the weekend, we are on Thursday, which is always a good thing. Emma, hello, Sylvia, how are you? Thank you all for joining us, thank you for taking your time to watch us. Just in case you didn't know, I'm John, this is going out live on EMPS Empowering Survivors. If I struggle for speaking and I have to cut short, it's because I have got, I've had to do another COVID test today. I've got a problem breathing, I've got a lack of smell, but it could be a cold, and a couple of weeks ago, well about 5 weeks ago, I managed to break 2 ribs, so it could all be linked there, but it's the lack of smell, it's the cough, it's, you know, it's a few things that's bothering me, so we will find out, that's for sure. So yeah, that's kind of like where I am with things right now. Pardon me. So what do I want to speak about today? I'm thinking about, I put a story up, and this is where I wish I had another device with me. Dawn, hello, I'll come back to you struggling in a minute. Tell me why you're struggling, Dawn, and I'll come back to you. So I've read a story today and I put it on Instagram, Talk and Thrive Instagram and EMPS Empowering Survivors, and it is about a gym owner, I believe he's called Nick, over in Liverpool, Liverpool, with him being in tier 3, he's got a gym open, and it was in the metro yesterday, and he has effectively been given £1,000 fine for people, hi Missy, how are you, for keeping his gym open. Now, why is that such an issue? Well, for me, fitness encourages a couple of things. You could be seeing that a gym is used to bulk up, you get bodybuilding, all that sort of thing. But you can also realise that gyms, Johnny, how are you? Gyms are also used for people to get frustration out. Once you get your frustration out, your mental well-being is back to normal. So this guy, Squiz, how are you? Hello to you. So this guy has been fined £1,000, and he's been fined £1,000 because tier 3 has been imposed and police have turned up. And in the video that they showed, there was 8 armed police officers turned up, fining him £1,000, and he wouldn't ask his gym to close because people were doing workouts. Here's the thing. Mental well-being is as important as COVID right now. Now, COVID is a genuine thing. There is no doubt about that. But let's just say this. From what my understanding is, gyms, yoga lounges, all of this sort of place, yoga studios, sorry, they're all hygienic. They are hygienically cleaned. The mats are cleaned. They are sanitised. Machines are sanitised after everybody's used them. They are more clean and more hygienic probably than our own homes. And yet they are being closed down because that's what the government guidance is saying. I think at some point there has to be a conversation had around the science behind why yoga studios are being asked to shut. Gyms will be asked to shut. But pubs can stay open until 10 o'clock at night. And I think a justifiable conversation needs to be had. And it does need to be had. I'd be interested in seeing if perhaps Robbie Moore would be interested in a conversation. And it's not an antagonising and not a conversation of antagonising anybody. So if anybody sees this and they know Robbie Moore, or they could get this to Robbie Moore, I'd be interested to understand the government's science behind something so we could ask serious questions. In that conversation, I would also like to ask an owner of a gym to speak, and I would also like to ask an owner of a yoga studio to speak. Funny enough, I know just the owner of a yoga studio who could come and speak. I think we need to have this conversation because there's something not being understood. We're not being told everything. And if we are being told everything, it's being told in a way that we're not understanding. It's quite simple. If I don't understand something, I'll phrase something, can you talk to me like I'm 4 years old? Sometimes being spoken to like a child actually helps. And it helps because it takes it to the most simple of levels and it allows you to understand things clearly. And I think that is what is missing. This tier system is confusing me, absolutely confusing me. It's like the 10 o'clock situation. Right, pubs, 10 o'clock shut, what's going to happen there? You're going to have people half cut. You're going to have people half cut, they're all going to converge on the street. Where they're going to head? Let's go to a supermarket. Supermarket's going to serve alcohol until 12 o'clock at night because they can. Because there's been no rule change. There's been no rule change to correlate with the fact that pubs stopped serving at 10. Do you see where I'm going here? So let's just imagine that you have all of these people turn out and they're then going to rock up at supermarkets and buy booze. So you're going to have people who have been asked to leave pubs because COVID could be a risk to potentially then go to a supermarket which can stay up until 12 because apparently COVID isn't a risk within a supermarket, but the people who have left a pub who have been drinking and once it's after 10 could be a risk because of COVID, could go into a supermarket, buy a drink and carry on, and it just sort of perpetuates. So my first question would be, if a pub has to shut at 10, why can off licences, alcohol, supermarkets, why can they all serve alcohol after that? It makes no sense to me. It's this sort of thing that I'm not understanding. Let's have a look. I'm missing people's comments here. So Dawn, it's not doing my mental health, isolating myself in my bedroom a lot. Close gyms but keep the pubs open, it doesn't make sense. I expect the schools will be shut near half term in England. Seems to me it's about money, not people. Kath Was. Kath, how are you? The gym I go to is excellent, definitely helps me mentally and physically. I'm totally with you on this one. Dawn, we're on tier 2 here. Totally agree, John. See, this is the thing. We are... this whole tier system is a complete and utter struggle. It's a struggle because people aren't getting it. This rule of 6, people aren't getting it. So I could be at work. I could have been in a team of 7. All 7 of us could be working in a team all day. We could be good. We could be then thinking, right, let's go out for a team meal. Well, hang on a minute. Once we leave here, COVID could get us. So one of us is going to have to choose the short straw and not come out. Makes no sense. None. Nada, not a thing. Circuit breaker lockdowns. If that's going to work, brilliant. Let's get it working. But can we please have the science behind why a circuit lock breaker is going to work? Here's the thing I've got a theory about. I keep reading that at Christmas, kids, well, when I say kids, students at university may be asked to stay at university over Christmas. I think if I was looking at this logically, this is my view on why that would happen. If you are a student and you are at university, you are already with your peer group. You are already with people. So by being asked to stay at university, you have people around you. We only have to look at Manchester, where 1,700 people were asked to isolate because there was over 120 people contracted COVID within a week. Now, if you ask these people to stay at university, that means the elderly population can go spend time with families. So you've got a trade-off. That's my view on it. That is, if I was making decisions, I would be looking at it like this, that, okay, it's not great that you're splitting families up, but you've got students who can be together and they've got people they can talk to. On the other hand, you've got elderly people, and if you've got students who are coming from places where there could be COVID and you go back into communities, you could be passing COVID to the elderly. So how do you stop that? You stop the students coming back into the community. The elderly can go to families at Christmas. Students can have Christmas with their fellow students. Elderly can have Christmas with their families. Everybody has Christmas with somebody. That would be the logical way of thinking. If I'm wrong on that, I'm wrong on that. But again, somebody should explain, why would you want to keep students in university? It makes no sense. Missy's saying this. What are your thoughts on the government doing all this chaos creating so that in the end people will want to have the vaccine whether they wanted it or not? Just a line of thought someone mentioned to me at the weekend. Okay. Vaccines. Here's what my thought is. For the longest time, people have been taking flu vax. And they've been having flu vaccinations because flu kills. It's your choice whether you have a flu vaccination or not. But it shows that those who don't have flu vaccinations, they generally have a higher rate of death than those who've had the flu vaccination. So I'm imagining that COVID vaccination will be a similar thing. My view is I am going to have a COVID vaccination, but I want to know that when it's given to people, I want to know what happens. So I'm not going to immediately jump in and be a guinea pig. I want to see what happens. I want to see, is this vaccine safe? Is it going to hurt me? Is it going to harm me? Is it going to cause trouble? I want to see how it works. I want to see the science behind it. We're living in a world of Project Fear at the moment where, COVID's wrong, the vaccine's going to track and trace us. Let's be absolutely right here. I do these videos on a mobile phone. We have smart TVs. We log into Google. We log into Spotify. We log into whatever we're logging into. We are already tracked and traced. The track and trace app isn't something that's controlling us or going to suddenly track and trace us. They already know where we are. They have done since smartphones came into existence. They've known what we've been looking at since we've had computers. So I don't think the track and trace app is a bad thing. I know somebody just today who's phoned me up to say they can't see me for a fortnight because they've been told to isolate because they've been within a certain distance of somebody who has COVID. So it's proving it works. Did that person get upset? No. They didn't get upset. They're just glad they've been told. They're glad that they've got a chance to sort of be at home and rest it out. So there's a lot of pragmatism there from the individual. And to be honest, I was surprised at the level of pragmatism. Now, what I'm not saying is it's necessarily the right thing. I believe track and trace should be a freedom of choice. But don't for a second think we've not been traced. Don't for a second think we've not been tracked. Because we have. People say that if we get rid of money, they'll be able to track us anyway. Well, what do you think money has on it? It has serial numbers. Of course they're going to know where money comes from. Serial numbers. It's we've always been tracked and traced. It might not be to individual levels, but they know where money is and they know where it's been spent and they know where it's come from and they know who has it and how it sort of goes round and round and round. That's just how it sort of works. Dawn, I can see the suicide rate has climbed yet again. Yep. It's also disgusting. The government has thrown homeless back on the streets. It's heartbreaking. Hello, Adam. Shared, I can't have flu jab because of medication I'm on. Thanks, Dawn. I'm not having the vaccine. I've lost trust in the government. Vaccine trials are going on in Bradford at the moment. Should help answers lots of questions. The Social Dilemma on Netflix is a great eye-opener on this. I think it's, whatever my view on this, so I want to make something very clear. So before I go any further, YouTube, please, please, please go to YouTube, log in, Talk and Thrive Stigma Fighters. Press the subscribe button, press the bell button, you'll start to see new content appear in the near future. I promise you that. We're trying to grow and we're trying to expand. Deborah, I agree, John, there's been a few positive tests at my kid's school. One of my lads has bad asthma and I've had to shield due to ill health. I had decided not to send my kids to school from tomorrow to protect, firstly, my son, but secondly, me. I'm struggling to manage my feelings with making decisions between my kids' education and our health, to be honest. I have get it. I am likely to be very ill, and I'm sure my kids would be affected more if I wasn't here. It's a difficult thing, isn't it? I know somebody very, very special to me at the moment who is currently off work because of quarantines kicked in at where they work. And it affects people mentally because they have to quarantine and isolate in a house. And sometimes in a house, you're on your own. What do you do when you're on your own? You can talk to people, but that touching people, holding hands with people, embracing somebody, it's just not the same. And it isn't the same. But at least we've got something where we can try and speak to each other. I do genuinely believe that the rules need to be made clear, and I do believe we need to have more open and frank discussions about what these rules are. I think it's wrong that we automatically disbelieve what governments are saying to us. I think that's wrong. But I also think it's wrong that we willfully believe anything that governments say, because we don't know if it's true. But what we should be presented with is factual based information. If there has been tests and there's been studies done, present those as findings and let people make their own judgments. Let people be able to have reference points, so when we have public discussions and I speak on things like this, I'm able to talk about how something's impacted because there's the statistics, there's the facts, there's all the work, there's the length of time, the period, the cultures, the sort of demographic, that was the word I was looking, the demographic that this has all been hitting. And we can learn more, we can learn about this virus in a much bigger way. The biggest thing that I would say about this COVID virus is, do not think of it as a cold or a flu. It is neither a cold nor a flu. It is a respiratory illness. And if it's a respiratory illness, that's going to affect your chest without a shadow of a doubt. Right now, I've got problems with my breathing. It could be the fact that it's to do with a couple of ribs that I broke repairing. It could be. But then again, in the back of my mind, that was 5-6 weeks ago. Wouldn't I have had more pain breathing before now? I don't know. I'll find out in a few days. All you can do is try and isolate the best that you can. Try and do what you're told to do, because there's a lot of frightened people out there. There's people frightened because they are being asked to wear masks. There's people frightened because people aren't wearing masks. There needs to be a way that we all get together and we all understand. Yeah, Jimmy, have you got a flight to Brisbane yet? Funny story today. I'm sat at work, I'm sat at my desk, and I get a call from a Brisbane number. And the Brisbane number rang and they said, this is so-and-so from Brisbane Immigration Office. I'm like, what? Can we progress your application? We just want to check a few details with you that you've got. I was just lost at this place at this point, that I've got a doctorate and I have some ridiculous amount of money in bank. And I'm like, I don't understand what's going on. And I made it quite clear I didn't want to move to Brisbane or Australia. And they were quite adamant, well, we've got your details, so we have to have got that from you. Well, it turns out it was my partner in crime, Jimmy Vaughan, thought it'd be hilarious to propose that I move to Australia. So in turn, I'm going to be flogging Jimmy Vaughan on eBay, I think. Or maybe putting him in for his own emigration somewhere. But to be honest, that really broke my day up, because I was having a struggle, I was having a bad coughing fit, and when I got that call, that was the funniest thing that I have heard in a long while. And yeah, you know, we do think we have got mental health issues of Jim and me, but we know how to have a laugh, and we have a laugh, and it eases and it lifts the brevity of what we do sometimes, and it's what's needed. Amanda, hello to you. Kath Was, would the media not still use this to push certain agendas through? It's them I trust less than anywhere else. Yeah, media's a funny one, isn't it? I think if you are going to be giving a view, I don't know, you see, I don't know enough about how media works. Have media got an agenda? Haven't they got an agenda? You look at BBC, you look at Sky, slightly different. You've also got RT.com, Russia Today. Now you look at RT.com and they will give you yet a further perspective on the news that's going on in our country, and they will report on things that our media won't necessarily report on. Now, here's the thing. So recently it was David Icke's son was doing a big protest about I think it was effectively people's right to choose not to wear a mask, that sort of thing. There's one of two ways you look at this. It's either the media didn't cover it because there's an agenda, or the media didn't cover it because what was being said could not be backed up by any scientific reasoning. If something can't be backed up by scientific reasoning, is it responsible to report on something? That's a question that I'd ask. I can't answer that myself. I don't know. How do you all feel? Do you feel that something should be reported on if there's like 20,000 people turn up to a gathering and that gathering is based on something that may or may not, that hasn't got any, let's say it hasn't got any qualified scientific reasoning behind it? Do we think it's the right thing to do? Do we think it's the right thing to go ahead? I'm not sure. I'm really not sure, to be honest. This is where I get confused. This is where I struggle, because I want to believe that we're not being lied to. Maybe I'm naive. I really do want to believe that we're not being lied to. Why would a government lie to us by trying to protect us from a virus? It makes no sense to me. But then again, is there an agenda that's trying to be furthered? And if there is an agenda, what is it? If you look at COVID, they're asking us to wear masks. All it is, right, masks. I struggle to wear a mask because of something that I went through. And this is why, this is fact. I struggle because of something I went through, but I will wear a mask. I know people who can't wear masks because they suffer really terrible anxiety to such a point that you can feel their heart rate beating, you can see their hands shaking, but they still try and wear a mask. Now here's the thing. If that mask there, or the face covering, is going to protect somebody, why would people be asking you to wear a mask if it's not? Now what I'm going to say is this: if there is no truth in masks, come March, April next year, there will still be the same number of cold and flu deaths as there's always been. If masks have worked, the cold and flu deaths will have dropped significantly, and they will have dropped significantly because masks will have done their job. And I think I'm going to give it the benefit of the doubt, and when I can wear a mask, I will wear a mask. Do I have an exemption? Yes. But I'm also trying to think that people are going to be frightened, so at the same time I will try and wear a mask whenever I can wear a mask. People who I hang around with, people who I care about, they struggle with wearing masks, but they also wear them when they can. So the people who I struggle with is those who won't wear a mask when they can wear a mask. That's what I'm struggling with on that. I really am. Jay, good evening to you. Really good to see you, mate. We need a catch up at some point. Obviously, social distancing at the minute, and I'm not being funny when I say that. I just think that that's going to happen at some point. Deborah, this is where media runs our lives. We should be seeing everything to make our own choices, not just showing what they want us to see. Dawn, I think there's something the government aren't telling us. Kath, good question. Not sure, but I'm not sure we'd get a balanced view, especially in some newspapers. Agree. Dawn, I'm exempt from wearing a mask as it triggers my trauma. Kev, it's a strange one, but just look at Sweden. They've developed herd immunity. Kaswas, agree, remasks. I'm wearing mine and most people I see do too. Yeah, interesting, isn't it? We were on the way to herd immunity until everybody shouted Boris's idea down, and then we veered away from herd immunity, and now you look at Sweden and it worked. Yes, you might turn around and say Sweden, it's a different dynamic, it's a different population, but it's still a population, isn't it? Still a population, it still worked. All I can say is this, I'm bringing tonight to an end. As we'd always say, we're not healthcare professionals on this channel. We're three lads, we've had a bad start in life, but we use our experience to support others. If somebody gets in touch with us and they're struggling, we will always signpost you to the correct medical place, because that's the appropriate thing to do. If you get in touch with us, press that button on EMPS, send us a message. If you send us a message and you're a female, we will talk to you initially. We will then pass you through to the Female Talk and Thrive group, because we believe that there should be a segregation. So female groups are run by females for females, male groups are run by males for males. We talk to you, we support you, we get you the right support. That's the important thing. Absolutely, the important thing is how this works. We're gonna keep growing. We're gonna keep supporting. Please go across to YouTube. You'll get bored of me saying it, so please just Talk and Thrive Stigma Fighters. Subscribe, press a bell. You'll get content on there. There'll soon be short videos on there, about 5 minutes long, where I'll just talk about subjects. Once we hit 1,000 subscribers, we can start doing lives on YouTube as well. Start doing bigger podcasts, that sort of thing. It's all exciting stuff that we've got planned. Here's the thing. If you know somebody who's struggling, and they know they're struggling but they don't know where to turn to, point them our way. Point them to our YouTube channel, Talk and Thrive Stigma Fighters. Get them to subscribe. But more importantly than that, they'll see videos of what we do. We might just appear relatable to them. If we appear relatable to them, they may feel they can contact us. They may feel that we can support. If you yourself are struggling and you're watching us, you'll already have made a decision whether or not we're right for you. And if we are right for you, get in touch with us. It's coming up to Thursday night, 7 o'clock. Enjoy the time now that you've got with your families. Love one another. Be kind with one another. We only have one life. We only have one family. Be kind to each other. You know, make time for one another. I'm going to be back tomorrow. Until then, see you later. Farewell. Have a good evening. But before I go, let's just say what Jay said. The media companies want to shift units, end of. Everything they say and show should be viewed subjectively. If not, they tap into your way of thinking and you get roped in. Agree? Deborah, hope you're feeling better soon. Thank you. Carol, I wear a mask because my daughter tells me that does work. Hope you're okay, hon. I will be okay, Carol. I hope. I'm kind of hoping it's to do with my ribs that I broke. That's all. I kind of hope that's what it is. I know right now I'm struggling with my sense of smell, and I know I'm struggling with my breathing, and I've got a horrendous cough. What I'm finding though is the cough's worse in the earlier part of the day than it is later on, so I'm kind of confused by it. But we'll see, we'll find out. I just also want to thank everybody for your support. This last year we've grown. We're continuing to grow. Without you, we're nothing. Without your support, we're not here. We thank you for that. We're going to shine a light on things. We are going to fight that mental health stigma. We are going to normalise the conversation on mental health. And we are going to get people talking, and we want a balanced conversation. So when it comes to COVID, let's see if we can get people in a room so we can have a facilitated conversation, just that's honesty. There's no preparation to it. We just turn up, we ask questions, and we get answers. That's great. I like that, Kev. It's nice to be nice. It is nice to be nice. And it's also great to be kind. See you tomorrow.